Good afternoon, everybody. Jelaine VanHelsing here. Today we're talking about benefits of hot and cold or heat and ice, or not necessarily just the benefits either, but like also what should you be using. Like when you have an injury or you're sore or anything, what should you do? Should you reach for that hot pack or an old traditional ice pack, eh? That's always works the best, you know. If you don't have a nice one, a little pad like this, just reach for the bag of vegetables in the freezer. So as long as you have some ice on there, it doesn't really matter. It doesn't have to be the fancy pack. This one is pretty awesome. It's actually hot and cold, so I like that a lot. And so there is benefits to both. And I want to tell you guys today though that if you are ever in a state of extreme pain, debilitated movement, so you know there's something restricted in some way, you can't quite, like, oh, it's like locking up in my shoulder, or you know, you can't turn your head very well, or you know, some back problems, even a person can't even stand up straight or walk or anything like that. Okay, that is inflammation, and you should never, ever, ever put heat on that, ever. And if you have a doctor or therapist that tells you to put heat on there, I personally would not ever go back to them again. So if it's like that, you need ice. And probably 9 times out of 10, people should be putting ice on their injuries or sore body for whatever reason, or old injury that acts up, or whatever it is. It should be ice. You know, with the heat, it really loosens the muscle and relieves the tension, and that's wonderful. And you know, if you can feel that and you got a tension headache and there's nothing that's debilitating your range of movement in any way, by all means put the heat on there. And once your injury even gets past that certain stage of icing so often, maybe you want to put heat on there once in a while. But definitely at first you should not be doing that at all. Even like a hot shower is too much heat on an injury or a part of the body that is not able to move in some certain way. So that's very, very important to know that, guys. Like, you see even the athletes in the ice baths and stuff like that, they are having that ice bath to calm the body. When there's heat, when there's an injury, the body naturally creates heat. There's an increased movement of cells and blood, and everything is dilated and opens up, and so you want to really be able to calm that down, and you would use ice to do that. And if you have an injury like that, or a sore spot on your body that is causing you pain and inability to move a certain way, do not put heat on it. Do not. That is the worst thing you're going to do. I personally had that with a low back injury. I was out skiing and I just fell down to stop from hitting a little kid that darted in front of me, and I was so sore and debilitated. Like, I basically crawled off that mountain, and I was putting heat on it. Like, I was quite young at the time, probably 19, 20 years old, and that's what I thought, that's what I had learned. Always put heat on it. Oh, you need a hot pack, that'll fix things up. But that didn't. It made it so bad that I was crawling. I couldn't do nothing. I had to crawl to go to the bathroom. But as soon as I put ice on it, it was only a day of consistently putting ice on it for that day that I was able to walk. And then of course I just carried on with the ice until I had full range of movement. But if you're going to put ice on your body and heat, you have to be careful. You don't put it directly on the skin. You can get heat burn or ice burn on the skin. So you put a cloth or whatever over top of your clothing. But with the ice, you would take that out of the freezer, put it on your injury, leave it there until it warms to room temperature, and then you'd put it back in the freezer. By the time that is frozen again, you would be ready to put the ice pack back on again. And I totally recommend that level of treatment. definitely for the first day or two of an injury, but you'll know as soon as you get that inflammation cut down out of there. Anyway, go with that, guys. And like ice, ice, ice. Like, you, so often ice is what you need to go with. So, just a little injury tip there. Have a wonderful day. Subscribe to my channel, and I'll see you next week.